Hi guys, this is Bailey Yeager. It's my presentation on schizophrenia. So, schizophrenia, everything you need to know. What is schizophrenia? It is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality. Although schizophrenia is not as common as other mental disorders, the symptoms can be very disabling. It can be very disabling by affecting work performances, relationships, and goals that were set. The image below shows what a schizophrenic brain looks like, which is on the left, compared to a healthy control brain, which is on the right. This image here shows that the typical onset is adolescence to mid-30s for schizophrenia. Your brain function changes. You have positive and negative symptoms, multiple multidisciplinary treatments, and multiple risk factors associated. Signs and symptoms. In teenagers and children, it's hard to recognize because the early symptoms shown in teenagers are common for the typical development of the teenager. And for children, their behavior, the changes can be slow or over time or start suddenly. And these symptoms include withdrawal from friends and family, a drop in performance at school, trouble sleeping, irritability or depressed mood, lots of anxiety or fear, disorganized behavior, and delusions. In adults, they have their signs and symptoms include delusions, which are thoughts and beliefs that are not based in reality, hallucinations, which is hearing or seeing things that do not exist. Disorganized thinking is communication that is effective but that can be impaired. So, when asked a question, the answers are not normally answered fully, or the answers are completely unrelated to the question. Word salad in this case is rare, but sometimes speech is hard to understand. They have extremely disorganized or abnormal motor behavior, which can be seen in many ways from childlike silliness to agitation. In some cases, they may show resistance to instruction, show inappropriate or bizarre posture, a lack of response, and useless or an excessive movement. They also show things called negative symptoms, which is decreased or inability to function properly or normally. And some people experience disinterest in everyday activities, inability to feel pleasure, and social withdrawal. This image right here shows a map of the population with schizophrenia in 2017. So as you can tell that the areas that are shaded lighter have less cases of schizophrenia, whereas areas that are shaded darker have more cases of schizophrenia. And Australia, China, and the US, Canada, Greenland, like as you can tell, they have more cases than Africa, Russia, and South America. Risk factors. For teens and children, the high screen time and cyberbullying can be a risk factor, along with poor family functioning, chronic illness and obesity, out of home care, genetics, unsupportive work conditions, and economic inequality. For adults, it's similar to teenagers and children. It includes genetics, social isolation and loneliness, insecure employment and unemployment, unsupportive work conditions, and economic inequality. Protective factors. Protective factors for teenagers and children include physical activity, anything like jogging, yoga, sports teams, strong social relationships with teachers and peers, and this includes online as well, so having a strong relationship online, positive family functioning at home, and community support. For adults, protective factors include employment, physical activity like running and yoga, etc., strong social relationships and networks. So this includes with your work environment and also your social environment that you have around you, and also a family environment as well. Diet and alcohol reduction, so less high-fat foods and also like less alcohol intake. Green space, which is an urban environment with vegetation, and lowers rates of depression and anxiety, and this has been known to help with people with schizophrenia because they're in a space that relaxes them and calms them down, so they're not as very disorganized. Diagnosis and prognosis. Diagnosing schizophrenia is not an easy task. There is not just one single test that can diagnose an individual with schizophrenia. The diagnosis is done by a healthcare provider after they evaluate the symptoms that the patient reports to them. The patient must have had at least two symptoms, anything from hallucinations, delusions, negative symptoms, or disorganized thinking, for at least 12 months to ensure the correct diagnosis. Acute onset has a good prognosis, and an insidious onset, which comes on slowly and does not have obvious symptoms at first, has a poor prognosis. But constant communication with doctors is a good way to overcome the poor prognosis, along with properly being treated for schizophrenia. So, having the proper treatment and resources available for you can change your prognosis from poor to a good prognosis so that it's not something that's debilitating. Treatment options. So, for people that suffer from schizophrenia, there's no cure, but it is treatable. The several treatments include medication therapy and behavioral management education that can help schizophrenia in many ways. So, although schizophrenia is not curable, it is treatable, and you're treating the symptoms of schizophrenia. So, you have first and second generation antipsychotic medications, which are used to decrease the hallucination and delusions that are associated with schizophrenia. So, this is treating the not psychoactive, but the hallucinations and delusions that that you have in your head if you're schizophrenic. And these have different kinds of medications that you can take. I'm not going to try to pronounce them, mainly because I tried to earlier and I butchered every single one of them. But you have the first and second generation antipsychotic medications. You also have psychotherapy, which can include things like cognitive behavioral therapy, supportive psychotherapy, cognitive enhancement therapy, and then also you can do things like complementary therapy options like acupuncture, meditation, and nutrition interventions, which can also help with schizophrenia. Resources available. So contact your doctor if you are experiencing any of the signs and symptoms of schizophrenia. They can give you the best help available and also provide you with the correct diagnosis and treatment options. You can also visit the National Institute of Mental Health to learn more information about schizophrenia. There's also support groups like the Schizophrenia Alliance group that you can join to be in a setting with other people that are going through the same thing. And then in Lynchburg, Virginia, on 693rd Leesville Road, it's called the Bridges Treatment Center, which is a treatment center that helps with mental health disorders. So it can help with treatment options and provide you more resources available in your community for schizophrenia and treating it. And these are my sources. Thank you.